continue.
Jessica, you can go ahead.
Hi, everybody. Thank you for the kind introduction. I'm Jessica. My co-presenters here are Tracy, Scott, Mike Knott, and Zahra Mamdani. We would like to start by acknowledging our research teams based in Victoria, Vancouver, Maple Ridge, and Coquitlam.
As you may know, illicit drug overdose is the leading cause of unintentional death in BC. We are currently in the midst of a dual public health emergencies in BC, the first of which was declared in 2016 in response to the unprecedented increase in illicit drug toxicity deaths, and the second of which was declared last year due to COVID-19. The onset of COVID has really compounded the impact of the overdose crisis for people who use substances. Since March 2020, when physical distancing measures were implemented, the number of drug toxicity deaths have been on the rise. In 2020, 1,724 overdose deaths were recorded in BC, which is the highest ever.
Tracy, that's you.
Are often most affected by the overdose crisis. These are individuals who have lived experience with substance use and incorporate that lived experience into their professional work. Peer workers are at the forefront of the overdose response activities in BC. They perform a variety of roles, including distribution or production supplies, peer witnessing and drug use, referrals to services such as housing agencies, advocacy, outreach work, overdose response, and research. The event of COVID-19 has led to the reduced hours to closure of several overdose prevention services, and this further increased the importance of peer workers who are involved in the outreach and phone response.
Tracy, we're having a bit of a hard time hearing you, so just get closer for your next slide.
We all know that working in an overdose response environment can be overwhelming and stressful, with lasting social, mental, and emotional impacts. Being a peer worker can be doubly stressful because we don't only face the trauma of others, but often also face the same factors that affect all people who use substances, such as stigma, low income, and lack of support. However, unlike other first responders, we lack organizational and mental health supports from our organizations. It is very important to understand supports needed by our peer workers and implement these supports and programs for us in overdose response settings.
The P2P project funded by Health Canada is aimed at developing, implementing, and evaluating models and strategies to support peer workers who are working in BC overdose response environments. The project is being piloted at 2 organizations, Rain City in the Lower Mainland and Solid Outreach in Victoria. Mike is from Solid Outreach, and Tracy and I are from Rain City Housing in Maple Ridge and the Fraser region. And Zahra is from the BC Centre for Disease Control.
The first step of our project included conducting needs assessments. This was done through 8 focus groups with the pilot sites. Several important findings came out of these focus groups. One of the top stressors that emerged from the focus group data is the lack of recognition and respect for peer workers. Several peer workers felt that they were not taken seriously or given due respect by their work colleagues and by other professionals they encounter in their work. Peer workers face a lot of inequity within their workplace. They often lack basic resources, which are generally provided to most working professionals, such as photo IDs or business cards. They also get inequitable pay compared to other workers without lived experience of substance use, despite the similar work done by them. Many peer workers also feel they are not respected by other professionals such as police officers, paramedics, and others. This lack of respect may be due to societal stigma that sets to define peer workers solely by their history of substance use, rather than recognizing them as working professionals. There is also a lack of awareness about the important work by peer workers done in overdose response settings. In today's presentation, let's dig deeper into what stigma in the workplace looks like for peer workers. And let's discuss how we can work together to tackle this stigma and improve recognition for peer workers.
We will start with a video from the Compassionate Action modules, an anti-stigma campaign consisting of interactive case study videos about stigma and discrimination experienced by people who use substances. This particular scenario is based on real-life experiences of peer workers. It was a joint project between the peer-to-peer team, the PEEP team, and the cultural safety team in Victoria. While watching the video, let's try and pay attention to the tone of the voice of each player, their facial expressions, their body language, choice of words, and the kind of work that the peer worker is asked to do. Let's hope the video works.
This girl's unbelievable. Jesus is OD, man. I know. Yeah, he's been around for a while. I saw you went to 2 minutes ago. That's when I saw him. Doing good. He's all ready to do it. And then all of a sudden, just goes up and then boom.
Take care, Moose.
Yeah, thanks.
Hi, Janet. How are you doing?
Shitty. Scout OD'd yesterday.
I heard. I know you guys are close.
She was like a sister to me.
I know it's hard. I'm here for you if you need me.
Just can't take any more people dying, you know?
Hey, Alita, do you mind grabbing some more 1cc's from the back? I'm getting pretty low.
Sorry, Alita, I know you have work to do.
It's okay.
Some of the peers have been complaining about their lack of access, and they're wanting keys.
Yeah, no. It's a huge safety issue.
I'm sorry, I didn't realize there was a meeting.
No worries, it was just for staff. We're just wrapping up. We good here?
Yeah, good.
Any word on that raise?
Yeah, we just got ours. I think you'll be talking about yours on Tuesday in the peer meeting.
Lita, can you take this trash out when you can, please?
Okay, so having watched the video together, let's dive into a discussion about the scenario we just saw. And as we mentioned, this is actually a real life experience of some peer workers. And you'll notice that in the video, the term experiential worker was used. So in case you're not familiar with that term, that's another term for the term peer workers. And when we did the peer-to-peer project, it was deemed to be the more preferential term. So we used the term experiential worker for the peer-to-peer project. However, it's the exact same as peer workers. So let's dive into this discussion. We are going to pause the recording here so that our discussion is completely confidential and just remains within this group. And then we'll resume the recording after the discussion is over. Go ahead, Jessica. Jessica, you're on mute. We can't hear you.
Sorry. We have talked about some solutions that can help address the stigma against peer workers. Let us now look at an intervention model that was designed for and by peer workers at Solid and Rain City as part of the P2P project. We found that the needs of peer workers could be categorized into three themes, and these form the basis of our intervention model titled ROSE. The R stands for recognition of peer work, O stands for organizational support, and S stands for skill development. The E emphasizes that the resources are for everyone. Tackling workplace stigma and improving recognition for peer workers fits under the R component of the intervention. Let us look at each of these strategies under the R component.
Mike, you're on mute too.
One of the interventions that was implemented under the recognition arm of the ROSE model were photo IDs and business cards for all peer workers at the pilot site. Photo ID and business cards are popular, tangible symbols of professionalism, authority, and validity within a role. The fact that peer workers often do not have them is indicative of the overall lack of respect for their roles. Photo IDs can be a visual reminder of a peer worker's importance within the organization and prevents the risk of them being unnecessarily questioned by those unsure of their role.
Another intervention that was implemented as part of the peer-to-peer project was the creation of a video titled #PeerLife, which features a day in the lives of our 4 peer workers. This video is centered around the idea of creating awareness of the work done by peer workers in order to address the negative attitudes towards them. I was proudly featured in this video, and I also wrote and sang the song featured in the video as well. We are now going to play a shorter version of the video for you.
Hey, baby girl. I love you. Hey, guys. Hey, good.
You want a hand in?
Yeah. My name is Denise Edwards, and I'm known as Grandma Coquitlam, Ma, Mom, or Grandma. I answer to all of them, and I'm proud to be a peer worker.
I became a peer worker just over 3 years ago. As a person, you know, that spent his life in prison and spent his life doing drugs, you know, I thought, well, what am I going to do for employment? Well, no one's going to hire me. And then this guy wants to hire me. And I said, well, what do you do? He said, we work with street people. And I thought, well, that's something I really know.
I'm a functioning drug addict, and I look around and I see my friends and even some of my family that have passed away and have overdosed and have caught different diseases, and I want to help. I've saved 72 lives up to date. I haven't lost one yet, and I don't plan on it.
Saving lives, you know, when someone comes out of it, you just feel elated, eh? It's like, whew, did a good job, eh? Shake the guy's hand, he smiles at you, eh? Or sometimes he'll just insult you. Yeah, so that cost $30, you just blew $30 off me. But I know that's him in that moment, because I know next day he'll come over and thank me for, you know, for helping him out, eh? And that's the best. Someone just says thank you.
The biggest challenge is the stigma. People have this idea that any addict is a useless piece of poo-poo. And that's just not true.
When I go out on the street, I see people for people. Just trying my best to be a human being. That's it. There's no big glamorous thing for me. It's just, you know, I want to help people because people help me.
Here's that patience, understanding, and drive. Wanting to help, the blessing is keeping people alive. We carry much on our shoulders out there on the scene. supply would make it right.
Mike, you're on mute.
The stigma and inequity faced by peer workers cannot be changed overnight. It is our collective responsibility to work collaboratively and help to improve the experiences of people that use substances. We hope that our presentation has been useful and informative.
And we would really like to take a moment to highlight some of the other resources that have been developed by the peer-to-peer team. We have the BC Peer Worker Leadership Trainings. We're going to have 5 or 6 modules in total. 2 modules are already up, and this is designed by peer workers for peer workers. So we would highly encourage all of you to go and check these trainings out. So module 1 is on recognizing signs and symptoms of mental health disorders and how to respond to emergency situations within certain mental health disorders. Module 2 is on effective communication for peer workers. Module 3 is on counseling skills and peer-to-peer debriefing, which will be uploaded very soon. And we have 2 more modules coming up, one on organizational etiquette, and then the 5th one is on conflict resolution. We also have a lot of information about the peer-to-peer project and the ROSE model, which we shared today. And you can check out our website. It's towardtheheart.com/peer-to-peer project. We also have a few resources for the dual public health emergencies, including some trainings and info sheets. And the module that we watched today, the anti-stigma module, is 1 out of 5. So there's 4 more modules that you can go and check out on the stigmatizing experiences faced by peer workers and by people who use substances in general in their day-to-day lives. So do take time to go and check out our webpage, and you'll get all these resources. And that's it for us. So thank you so much for participating. We're going to open up the floor now for an open discussion, but more of you talking, and now we can be the listeners. So thank you again for attending. This was an amazing discussion, and I hope that you've all benefited from this particular training. Thank you.
So we're going to stop recording now so that everybody can ask their questions.